Hi, my name's Randy Beckett, and I'm a psychiatric nurse practitioner, and I live in Mount Pleasant, South Carolina. When people find out I do telepsychiatry, they ask me a lot of questions, so I'm going to try to help answer some of those for you here today. I started as a nurse practitioner in 2006 as a family nurse practitioner, and then finished my postgraduate certificate as a psychiatric nurse practitioner in 2009 for adults only. And then I finished my DNP in 2012 with an emphasis in inpatient and outpatient geriatric psychiatry. So I'd been going to a brick and mortar practice for a long time and started looking into alternative ways to deliver healthcare. And one of the things that I did in the clinic practice where I was is started using early televideo conferencing software for psychiatric visits so patients wouldn't have to come to the office because sometimes gas money and other things were an issue. So that got me interested in telepsychiatry, and I started looking around, and I found a company in Omaha, Nebraska called Encounter Telehealth. And I started working with them part-time and slowly building my practice with Encounter Telehealth, and then slowly decreasing my practice at the primary care clinic until the time came on May 31st, 2015, that I was able to switch totally to working with Encounter Telehealth. Now, all of my patients, even though I live in Mount Pleasant, South Carolina, and I work out of my home office, all of my patients are residents in nursing homes in Iowa and Nebraska. I have right now about 29 facilities and several hundred patients, and they range in age from 19 years old all the way up to 100. And from people with very serious mental health issues or physical issues that contribute to mental health issues to dementia, bipolar disorder, any other combination of things that you can think of that a psychiatric nurse practitioner would treat. So this is growing very rapidly. First of all, with Encounter Telehealth, it's growing very rapidly. We're in about a half a dozen Western states and Midwestern states now. So most of the spending for telehealth is paid for by Medicare. And in 2016, there was a 30% increase over 2015 in payments made by Medicare to providers for telehealth. However, that amount was still only $28.7 million, which in a budget of over $600 billion for Medicare was less than 0.0005%. So telehealth is still a fraction of spending for Medicare. However, it is increasing as our aging population increases and needs for telehealth in rural areas increase. Now, right now, Medicare pays for, and Medicaid pays for, telehealth and telepsychiatry services provided in rural areas only. And also it has to be in a nursing home or in a hospital or a clinic or a federally qualified healthcare center or dialysis. There are certain facilities only that can use this. Now, the provider can be anywhere. So I live in South Carolina. As I told you, my patients are in Iowa and Nebraska. So there's two terms to become familiar with. Where the patient is, in my case a nursing home, is called the originating site. And where I am is called the distant site. So the distant site can be anywhere. And the originating site has to be in those specific locations in rural areas. So what typically happens is I see a patient and there's a nurse or a social worker or a CNA or somebody else from the staff with me to go over the medications. And often there's family members present as well. The staff member will tell me how the patient is doing or the resident, and then plus I'll have a conversation with the resident as well and prescribe medications. Now, there are patients with severe dementia with whom communication is pretty limited, but still benefit from the service to help them with depression and anxiety as observed by family members or staff, or with behaviors related to dementia. So up to this point, most people have come to telepsychiatry the way I did, through being in a regular brick and mortar practice for some time, seeing patients face to face. But this is changing. New graduates are now moving directly into telepsychiatry. Of course, there are training programs being developed by universities and colleges of nursing across the country to incorporate telepsychiatry. And then plus, like in Encounter Telehealth, we train our new providers very thoroughly in the use of the technology for the video conferencing as well as the electronic medical record. So it is now an opportunity for new providers because the literature is that the outcome is the same, whether you're face-to-face or whether you're using telepsychiatry. So this is a new opportunity for psychiatric nurse practitioner students, new graduates, or experienced people who have been doing this for a long time. This is going to grow rapidly with the aging population, more dementia, and also more emphasis on mental health related to recent opioid crisis, substance abuse. Telepsychiatry is growing at a rapid pace. And we need people in telepsychiatry because, as you know, there's a shortage of psychiatric providers across this country. We could double the number of psychiatric nurse practitioners today and still be short. So I wanted to give you this overview today so that you know that it is a viable option for new practitioners or for seasoned practitioners and a great way to practice because it's a lifestyle. You can work from home, you can work from virtually anywhere in the United States with proper licensure and have a lifestyle of being flexible in your location as well as your work schedule. So I encourage you to look into telepsychiatry as an option for your career. Thank you for your time today.